Hello, I'm Bill Wood, Social Studies, Voices Across America. The podcast this week was affected by Hurricane Michael. We had some technical difficulties reaching into North Carolina, so the program will look a little different this week, but the information is golden just for you. Make sure you listen because it could affect your medical insurance. Thanks for sharing this next half hour with us. Hello and welcome. This is Social Studies, Voices Across America. I'm Bill Wood.
And I'm Peter Goldsmith.
Our guest today is Susan Mangrum, a certified senior advisor in the insurance world, Hendersonville, that's near Asheville in western North Carolina. She specializes in helping seniors with their insurance, especially things like Medicare. That's what we're going to be talking about today. Susan, welcome.
Thank you. Glad to be here. The hurricane has descended on us this morning. We got a lot of wind and rain, but other than that, the sun is shining now.
The sun is shining. Susan's a song, isn't she, Peter?
I'll tell you what, I've known Susan for a lot of years. A, she's a delightful person, and B, she surely knows this stuff in depth. So we've got a good person with us. Susan, nice to see you again after a while.
You too, Peter.
Yeah. All right, let's get started. Peter, you've done some business actually with Susan, haven't you?
I have done business with Susan. Actually, Susan was took care of our insurance for years, and Susan advised us about which Medicare to take and drug plans and so forth and so on, because it's really a morass out there. It's very hard to know what you need and what this is and what that is. And as we're airing today, on the 15th of October, this is the first day of open enrollment. So, Susan, talk to me about what is open enrollment and what do we need to know? And let's start the ball rolling.
Okay. Open enrollment. Well, first of all, you know the government, they have lots of acronyms. Open enrollment is the period from October 15th to December 7th every year that impacts Medicare enrollees in two ways. One, if you have a Medicare Advantage plan, this is the time that you can change it from one plan to another. This is the time that you can, if you don't have a Medicare Advantage plan, this is the time you can buy one. Okay. The open enrollment this time of year does not impact people who have Medicare supplements. And I get a lot of calls from my insurers that say, well, you know, Susan, I have a Medicare supplement. What should I do? I say nothing unless you want to enroll in a Medicare Advantage plan. So Medicare supplement people don't have to do anything. This is all about Medicare Advantage plans and Part D, which is drug coverage.
Susan, tell us for a second about what an advantage, a Medicare Advantage plan is, so that we know if we have them or not.
Okay, well, a Medicare Advantage plan is an HMO type of product.
Okay.
It is a very narrow service area. An Medicare Advantage plan is referred to by Medicare as private insurance. So if you have a Medicare Advantage plan, when you go to the doctor, to the provider, you just hand them your card that is from AARP, United Healthcare, it's from Humana, it could be Blue Cross Blue Shield, it could be in this state, it could be Cigna, and that is your plan. You are technically not in original Medicare anymore. It is private insurance.
So you don't need to show your original red, white, and blue Medicare card at the doctor's. What you would do instead would be to show him, I'm using Humana metaphorically, your Humana card, whatever it is, Humana card.
Yeah, right, exactly. If in the other, like I have Medicare supplement, so I am enrolled in original Medicare, so I have my red, white, and blue card, and then I have my card that shows the company that does my Medicare supplement. I am in what's called original Medicare. Medicare Advantages are private insurance, and therein are some of the flaws.
So now we all, as we turn 65, get a red, white, and blue card, which is a government card. And then we have to pay to get an Advantage card. And there are many providers of that card. So we need to choose which one we want to go with based upon what we need and what we want.
Yeah, correct. Now, just so you know, as Medicare supplements offer all the same benefits, Medicare Advantage plans are very similar. They have parameters that are set out by Medicare that they have to comply with. Okay? You do not have as many providers of Medicare Advantage plans as you do Medicare supplements. And they vary from state to state. One of my, when I do my due diligence, when someone says, I want to know about Medicare, and I'm telling them the difference between a supplement and a Medicare Advantage plan, I explain that a Medicare Advantage plan is not portable because it is an HMO that's quite local. So I ask people what they're looking for. Do they travel? Do they live 6 months in one state and 6 months in another state? Medicare Advantage plans are preferred by a lot of people because they are more affordable than a Medicare supplement.
Okay.
And they include drug coverage, whereas with a Medicare supplement, you have to buy separate drug coverage.
All right. Let me jump in here a minute because I want to understand something. First of all, this is what I'm sure you got it also. This is
right. Yes.
We received in the mail. Medicare and you, everyone, I guess, in our age group received this. If you're signed up for Medicare, you got this booklet. And in this booklet, it explains a lot of what your options are, what Plan B, Plan A, and so forth. So how does this booklet relate to what you just explained to us?
Well, I'm trying to figure out how to make something that's unnecessarily complex simple.
Good.
The Medicare and You book goes to everyone enrolled in Medicare. From a promotional standpoint, the book primarily promotes Medicare Advantage plans and doesn't list all of the Medicare supplements that are state to state. And I will just tell you why. I mean, you asked me to help make something simple. The Medicare would much prefer that everyone had a Medicare Advantage plan, because in a Medicare Advantage plan, if I may use a Southernism, you have a dog in the fight. Because with a Medicare Advantage plan, you have a lot more financial responsibility because you have out-of-pockets, you have co-pays, you have sometimes you have to pay 30% of a service. So the more people that Medicare has that is enrolled in a Medicare Advantage plan, the more money Medicare saves.
Okay, so let me step in here a minute. I live in California. What I have, from my understanding, I'm enrolled in Kaiser, an HMO, Health Maintenance Organization.
Yes.
I have Kaiser. So what my understanding is that I have Medicare and Kaiser as my Plan B. Am I wrong in that assumption?
Yes. Yes.
All right. Way to go.
All right. When everyone enrolled in Medicare who either wants to have a Medicare supplement or a Medicare Advantage, you have to have Medicare Part A and B. That's the red, white, and blue card. Okay. Yeah, I have a Medicare supplement. So I have A, B, and my supplement provides that service. If you have Kaiser Permanente, then that is a Medicare Advantage plan. It doesn't really serve as a supplement. It provides a lot of the services that a Medicare supplement does, but the terminology, you can't say it that way. Let me tell you how they really work, and maybe it'll make more sense.
Okay.
Back in 2006, when Medicare said maybe we need to get into the business of private insurance and quit trying to do everything we're doing. So they put out the call for private insurance companies to design a private plan that is similar to a Medicare supplement, but could do more things. Like some Medicare Advantage plans offer a little bit of a dental, maybe offer something for hearing aids. They can go outside of the box. To do that, Medicare pays the private insurance company who offers the Medicare Advantage plan a certain amount of money every month. It's typically, the last time I looked, it was $1,300 a month. With that $1,300 a month, your private insurance company manages your health. Medicare is out of the business. Okay? That's the way it works. And so what these private insurance companies do, one of the things they do is they offer some extra things to entice people to come into their plan. But they get paid to manage your health. Now, in the same vein, they also get paid to save money, which is why they are, as I said, they act as an HMO. The service area for Medicare Advantage plans in some states is not nearly as large. If you have original Medicare, if you have a Medicare supplement, any provider in the United States has to accept what you walk in the door with. That's just the way it is. That's Medicare's rule. But if you have a Medicare Advantage plan, your plan more than likely, Bill, is not even portable to Oklahoma.
No, it's not. It's not portable, certainly, to Ohio. Kaiser is not in Ohio. So if I move to Ohio, let's say, I need to get either another HMO or go to Humana or Cigna or someplace else, and then that will be my plan. And I'm confused, I guess, about what is Plan B. What's the difference between Plan A and Plan B?
Okay, Plan A is if you were sitting here beside me, I could draw you my picture that I show all of my clients. Plan A and Plan B together pay 80% of all of your medical bills. Okay. If you're in original Medicare. Plan
That's
A
government.
Hospital
It's
part.
Government. A and B, the government, right. So we all have that.
Yeah. Plan A pays your hospital bills and Plan B pays your doctor bills.
Right.
And you pay for the privilege of having Plan B, not knowing you're fine. And Plan Part B is paid for what you're charged for relates to how much to your income. That started 3 years ago. So, Bill, if your income is more than $900,000 a year, then I know that you pay more than I do for your Part B.
Okay.
Just saying. Just saying. But so you have to have A and B to have a Medicare Advantage, because the money that's paid in for the Part B comes from what the government pays Kaiser to handle your health care. What I like to show people is where it starts. The provider sends all of the bills with original Medicare. I have Part A and B, and I have a Medicare supplement. When I go to the doctor, they send all the bills to Medicare. Medicare approves, and Medicare then pays the provider 80% and sends the rest of the bill to the Medicare supplement, and they pay the 20%. Okay? With what you have, anyone who has a Medicare Advantage plan, Medicare is not in that loop at all.
Oh.
All of the bills go to Kaiser or to Cigna or to Humana or to United Healthcare.
Okay.
And they have to pay them out of their pool of money, which is why.
So wait, hold a second. So I am still covered, right? I don't have to go out immediately and go find some insurance to cover.
No.
I'm still covered between Medicare and Kaiser. I'm still covered.
Yes, but Medicare is not paying any of your bills. Kaiser is.
Kaiser is.
Yeah. Okay.
Yeah, because Medicare is paying Kaiser $1,400 a month to take care of you. And I will throw this in, whenever the talking heads or the politicians and their talking heads start talking about cutting Medicare, that's what they're talking about, is cutting that monthly amount that Medicare is going to pay the private insurers to be able to maintain their Medicare Advantage plan.
Okay. So wait a minute. Wait a minute, Peter. Let me follow this one more step.
Go ahead.
This introduces politics, and we try not to. We dance along this line in our social studies, Voices Across America. If they talk about privatizing healthcare, and I have to get my own, whether it's Blue Cross or Blue Shield or wherever it is, I have to get my own insurance. That becomes a voting issue, doesn't it? That we want to get people in office who don't want to privatize this Medicare, right? Is that what?
Well, it depends. You started general and then you lasered in and you said Medicare. When people are talking about privatizing, they could be talking about under 65. That's a whole nother issue.
Okay.
If they talk about privatizing Medicare 100%, then everybody on Medicare would have a Medicare Advantage plan, because Medicare Advantage is private insurance.
That's just short of single payer, where the government pays everything.
Right. It is, because, like I said, and I say this all the time with my tongue planted firmly in my cheek, insurance companies are not philanthropic. They are in the business to make money. So it stands to reason that that's why Medicare Advantage plans are like HMOs. A Medicare Advantage plan can say, no, Bill, I don't think you need that. You see what I'm saying?
Right.
They have more control over what you can have and can't have, which is one of the reasons when you're talking about privatizing insurance, you have to say, well, do you like your Medicare Advantage plan? Do you like the way it works? Because if Medicare went 100% private, everybody would have that. Everybody would have that kind of insurance.
Susan, let me ask you this. You said you have Medicare Supplement as opposed to Medicare Advantage. Tell me a little bit about why and which you think is better.
Well, the fact that I have that I stick with original Medicare and have a Medicare Supplement instead of Advantage should give you an idea.
Correct.
To which I think is better.
Of course.
But it all depends on your vantage point, in that I travel. And to go back to something you said, Bill, if you went to Ohio and you went to a Cigna or a Blue Cross, they're not going to take care of you. And even if there were a Kaiser Permanente in Ohio, which there is not, they wouldn't take care of you. In other words, it's really not going to travel. So what you're going to have to do is pay the bills, and then you come back to California and you give those bills to Kaiser and see what they'll give you back. So when I go to visit family in Missouri or go to the Derby in Kentucky or wherever I might go, and I suddenly I'm sick and I need appendicitis surgery, all I do is go to any place that accepts Medicare, which is every place, and Medicare gets the bill. It's that simple. So for me, it makes my life simpler.
Okay.
Does that answer your question?
No, it doesn't answer mine fully. So then why do I have Medicare Advantage, which I do?
Since when? I thought you were my client. I didn't sell you a Medicare Advantage plan.
Oh, I have Supplement? Oh, that's great. Thank you. I feel better now. I forgot. That's my wife's business, Susan.
I thought you were cheating on me, Peter Goldsmith.
No, I get you. So, okay. Because I had Humana for a while, didn't I?
No. You had Humana, I bet, for your drug plan, for your drug problem. Yeah.
Okay. My drug problem? That was my next question to you. Let's get straight. I don't have a drug problem. As a matter of fact, I don't take drugs. And you, of any kind, even aspirins, as you know, you suggested I take a very inexpensive drug plan, which was not terrific. Right. But since I didn't take drugs, it would be good to have my foot in the door, so to speak, so that if I did need them further on, I would be already recognized. Talk a little about that, because that's what you did.
Well, what you're talking about is really having your wallet in the door. And I can go back and tell you, in 2006, when they took the drug coverage out of the Medicare supplements, created the prescription drug plans, and created the Medicare Advantage plans at the same time. Right. It was supposedly made clear, and it wasn't, not everybody's on the internet, that if you didn't buy a drug plan at that time, you would pay. And that's true. You have a penalty. So I've had people that have come in and say, or usually maybe it's the adult child, and say, my dad now has diabetes and he has all of these expensive drugs. He never bought a drug plan, and so now I want to buy him one. Well, I have to tell them that the drug plans have now been around for 12 years. So if daddy wants to buy a drug plan, he's going to pay 144% penalty in addition to the drug plan monthly premium. So, and so sometimes, depending on the drugs, I tell people, I try to give them other suggestions, because it's not going to pay. It's not going to pay. But so there is, and I'm making it a little bit simpler, because there's a national, like for instance, if I haven't ever bought, if I went on Medicare last year, and then 2 years from now, I want to buy a drug plan. So I'm going to be penalized 1% for every month that I didn't buy one. So I'm going to be penalized 24%. Let's say that I then buy a drug plan that is $30. Then 20% of 30 is going to be added to that 30. And that's what I'm going to pay each month. And that penalty is going to stay with me until either Medicare implodes or I die.
So what we're talking about, if you were spending $100 before, then suddenly the penalty, 144%, would be $244. Wow. Just for the same thing.
Yes, right. So I tell people, if you wait a year, because more people than not say, I don't take any drugs. And I say, okay, well, here, let me do my due diligence here. If you don't buy a drug plan this year, but next year you decide you want to, you're going to be penalized 12%. That's not going to be that big a deal the first year, but it is eventually going to add up. So here in North Carolina, since we've always had drug plans, there's always been one that's been like $12. So I tell people, sign up for the cheap one, the cheapest one, and then that way you're covered. So if you ever need a more expensive one, you can move. Drug plans don't have any kind of strings in that you don't have to answer health questions. All you have to do is say, I want this one, name, address, Medicare number, and you're off. And back to what we originally started talking about, is this is the only time of year when you can buy a drug plan, from October 15th to December 7th. So you, whatever drug plan you buy, you have to stick with it. Whatever Medicare Advantage plan, you have to stick with it for that year. Back to also what I said, this is not a time of year that involves Medicare supplements. You can change a Medicare supplement anytime you want.
Oh, so you don't have to wait till October 15th. May 15th, if you want to make a change, you can make that change May, June, July.
Annual, for Medicare. Now, we're kind of sticking with open enrollment, and I won't talk so much about Medicare supplements. But one thing that people need to know is the first year after you've bought a Medicare supplement and you want to change, you can change anytime you want to. But after that first year, you have to answer health questions. So if you have been diagnosed with diabetes, if you've had a TIA, if you've had some kind of health issue, the insurance company to which you apply doesn't have to take you. The first time you apply, I hope this isn't too colorful for your listeners or watchers. The first time you apply to Medicare, I call you a Medicare virgin. You bring no baggage with you. You answer no health questions. You're in, no matter what chronic condition you might have. From then on, you have to answer health questions. So I tell people, which is why there are only certain companies. I only work with A-plus companies, because that decision you make when you turn 65 may be a decision you have to live with forever. So you need to make a smart decision.
You need to talk to a smart professional is what you really need to do.
Well, that's true, but I really hate to blow my own horn.
No.
but it is true.
It is. I mean, you need to, yeah.
Yeah, you shouldn't buy a Medicare supplement just because your neighbor bought one or because it's the cheapest one. I mean, there really is you get what you pay for kind of thing. But it's like when my late husband went into Medicare, he was uninsurable. So I made sure, and I knew who I wanted him to buy. I did not sell him the one that I would have gotten the highest commission. I mean, he was my husband. but I knew the companies that had the history because I knew that he could never move again. And that's the kind of guidelines that people need to make all the time. And the same thing with the Medicare Advantage. The first year that you have a Medicare Advantage, you can change the second year during open enrollment. No questions asked. After you've had it for 2 years, you can't change if you have a health problem. And I feel like my boss here, Will Penny, teases me that I take an hour with all my Medicare clients the first time. And I say it's because we do Medicare 101. But once again, my due diligence is make a good decision with your Medicare Advantage, because if you have it for 2 years and then want to move and you have health problems, they don't have to take you. This whole open enrollment alderah doesn't make that kind of stuff clear. It just doesn't. And as I said, I'm big about due diligence.
You mentioned a couple of times about having ongoing issues, and maybe that becomes a problem in your second and third year of signing up. I thought the Affordable Care Act said that they had to accept pre-existing conditions.
You're exactly right. The Affordable Care Act is all about no pre-existing conditions. Okay? You're exactly right. That's why it's so expensive. Back to the fact that insurance companies want to make money. So when you can't be selective with your pool of clients and you have to take someone who's on kidney dialysis right along with a person who has perfect health, then you're going to really lose money on the kidney dialysis. But guess what? If they're the same age, it's the same price. So a 50-year-old who has renal failure and is applying for a plan is going to pay exactly the same as another 50-year-old who's as healthy as can be. And so what the insurance companies try to do is to price it. So, guess what? They're still going to make money. But that's the way it works. And that's why it's so expensive. And I understand why it's so expensive. I do. But it's just this year here in North Carolina, most of my clients are calling me with a 15 to 20% rate increase. And they were already paying maybe $1,000 a month per person. So there's some real issues, and I don't know what the fix would be. I mean, there's a lot of problems that I can see that could be fixed, but the primary issue with the cost of, we just call it Obamacare with ACA plans, is the fact that there are no pre-existing conditions. And what some people do, which is exactly what people think, and is they know that they're going to have some kind of major surgery. So they enroll, they get their surgery, and then they drop it. And then they can enroll again the next year. There is no, there's no gatekeeper for that. But there's not with Medicare either, except that if you disenroll in Medicare because you've had a health problem, then you're not going to be able to enroll again.
So,
but with Obamacare, you can.
The smart thing to do then would be to go to a person like you and enroll in a plan that's outside of the Affordable Care Act and I will be able to get something less expensive. Is that what you're saying?
There is no such, Bill. There are no plans sold in this country that are not ACA blessed. That's the rule. Now, there are two things that people do. One of them I don't do. There are some religious organizations who have put together a network, and people pay to be a part of that network, and then they just hope that if they have a $40,000 bill, the money is there in the pool to pay for it.
Wow.
Those organizations are self-regulating. So that's one thing. If you, and the government gave these religious organizations an out in that if you are a member of one of those organizations, you do not have to pay a penalty if you don't have an ACA plan. Okay. The other option, which has become quite popular, are what are called catastrophic plans. It's a high deductible plan. Okay. 2,000, 50, 12,000, and it's for people that are just positive they're not going to get sick or get hit by a car. That's the way that one works. But any other health care plan is in the ACA. There's no people call me all the time and say, can I get something cheaper? I say, no, you can't. It's not there. And I don't think enough people were paying attention when all of this started 3 years ago. I think a lot of people just thought, well, I can go get something else. I don't have to get it. Well, not only do you have to get it, you have to pay a penalty if you don't. I'll tell you another little interesting tidbit as a red flag. If you apply for an ACA plan and you want to see if you can get a subsidy, I just call it a discount because that's what it is. Don't not tell the truth about your income. Because as you know, if there's anything sure in this country, it's death and taxes. The only thing that's worked swimmingly in the ACA plans is the fact that at the end of the year, the IRS knows who has insurance and knows who didn't. And I actually I've had more than one. I've had clients, or not clients, but people call me after the fact and said, well, my accountant said that he could help me kind of beat the system. And we did this and that, and I got a big subsidy. And guess what? The IRS is at his door wanting $10,000. That's why I say attorneys should do the law, accountants should do accounting, and let insurance agents do the insurance. That's my rule.
This really clears a lot up as far as the stuff, because it seems so complicated, and it is, but at least the way you put it, you can begin to think about what's really happening and what you need to know, at least to know the difference between A and B and C and all these different parts. Mm-hmm. And you deal mostly with people in North Carolina. I know that. Obviously, you live
right.
miles away from where I do. Is there a way for people to reach out to you who would like to get your expertise or sign up as clients or any of that stuff if they live here in the state of North Carolina?
Only in North Carolina. I'm licensed in North Carolina and South Carolina. But as much as I would like to take Bill's money, I can't sell him a thing.
Well, you should. You could always take Bill's money. He has plenty of it.
Of course, pennyinsuranceagency.com. That's the way people can do. Good. One of the things that I think is really important, and I run into this a lot, is an individual is not saving himself or herself any money by buying it directly from the company or buying it online. Insurance law is black and white. It's going to cost the same. So in the state of North Carolina, if you're going to buy from a Blue Cross, if you come to me and buy Blue Cross from me, it's going to cost the same. If you buy it directly from Blue Cross, it's going to cost the same. If you buy it online from some sort of e-service thing, it's going to cost the same. So it makes a lot more sense to find an agent and work with an agent because you're not paying anything extra at all. And then if you have an issue, you call that agent and they solve that problem for you.
Susan Mangrum, pennyinsuranceagency.com. If you're in North Carolina.
That's the place. And my picture is on the website.
Beautiful picture. Beautiful picture. Susan, thank you. You've answered a lot of questions for me, and I'm sure you've answered a lot of questions for some others. We want to try to get a relationship with Susan. Maybe we could do something with her on the AgnitusLife.com website, a webinar where you could come and visit, but I'm springing this on her right now. She knows nothing about this, but we've learned a lot now, and maybe we could learn something a little later on. About Susan Mangrum, pennyinsuranceagency.com, Hendersonville, North Carolina. Thank you. Thank you. And for those of you who are watching, we want to make sure that you stay in touch with us anytime you want to. We'll have a commercial here in just a second that will tell you how to reach Peter and I. Ask any questions that you might have. If we can't answer them, especially if they deal with insurance, Medicare, we're going to ask Susan and we'll get back to you. But Susan, you have an email that I don't know if you could do business, but if somebody from California or Oklahoma wants to send you a question, can you legally answer that?
Oh, sure, I can. The only thing I can't do is A, sell them anything, and B, advise them on what to buy in their state. Because Medicare, remember this, Medicare has its book of rules, and you can't deviate from those. I don't care what state you live in. Plus, Medicare has a set of parameters for Medicare Advantage plans. You can't deviate from those. So yes, I can answer questions about the genre. I just can't and wouldn't give advice what to buy. And my email is very simple. It's susan@pennyinsuranceagency.com.
You can't ask for anything more than that. You heard it from the expert. Till we talk to each other again, take care of each other and respect each other.
It's great to meet you. Great to meet you, Bill. Peter, I've been taking his money for 18 years.
And you will for another 18 if I'm lucky. Thank you, Susan. Thank you.
Okay.
Peace,
Bye,
everybody.
guys.
Peace.
You can get this podcast. You can tell someone else about this podcast. It's available through YouTube, through iTunes, and through Google Play. Let's hear from you. Let us know what you think so that we can be in community with you. And there is a way to contact us. That's at peter@agnituslife.com or bill@agnituslife.com. That's our email addresses. Let's hear from you. Let's open up the forum. I told you it was important. Thank you for sharing this last half hour with us. We're going to get back on our regular schedule in a couple of weeks. Thank you. Take care of each other. Respect each other. We'll be back. See you then.